Well, that's a loaded question. There are many side effects, as you just enumerated. Um, for the weight gain, keeping active helps. Tamoxifen tends to put on weight, hold on to weight, um, and there's not a whole lot that you can do about that. Um, the My libido after treatment certainly was low, and there really wasn't a whole lot offered in that regard um, for help. And I also have the enlarged prostate in the early stage prostate cancer, which doesn't help the libido at all. Also, with that, it's a self-esteem issue. I don't know that if all male breast cancer patients experience it, but I know some women who look in the mirror and they don't necessarily like what they see. Either they've not had reconstructive surgery, or they've had reconstructive surgery that didn't go well and they have to repeat it. But you have scars, you have battle scars. So there's a self-esteem issue component in there. Certainly for me, when I look in the mirror, I don't like what I see. Reconstruction for men really is limited, if not non-existent. My doctor, my breast surgeon, arranged for a plastic surgeon to be in on the surgery, and they tried to build up with my own tissue the area of the breast where they had removed it so that it wouldn't be quite so concave. My breast tissue is fairly deep, and so what they did was they debrided the top layer with the hair follicles, and then they took that raw tissue and kind of folded it in on each other and stitched it up so that that tissue underneath helped build up that area. So it wasn't quite so flat, not quite so concave. Um, and the plastic surgeon wanted to wait until I'd lost weight before she considered doing any kind of nipple tattooing or nipple reconstruction for me, and I probably will just forego that altogether. Um, let's see. Fear. Fear is a big side effect of having breast cancer in men and women. You don't know if you're going to be okay. You don't know if it'll come back. You don't know if it'll metastasize or if it'll come back in the other breast as a new primary. Um, you know, Thankfully, I've reached 5 years from my diagnosis now, but I know that that's no guarantee. So you always have that specter of recurrence um, lingering, lurking around. Um, you can say just stay positive and keep busy, but again, as I said earlier, positivity really doesn't equate to a better outcome. Emotionally it may help, but it certainly doesn't help the biology of cancer. Try to stay out of your head as much as possible. Keep busy. Find new hobbies, especially if you're not working. Try to find things that keep you busy. A lot of the cancer centers run different classes, weekly courses. I know ours. I host a weekly journaling group, which is more of a creative writing group. They have an art therapy group. They have something called a Hope Support Group, which supports family members as well as the patients. So keeping busy certainly helps keep out of your head and may help quell some of the fear. At least lets you forget things for a while. Having faith in some higher power certainly helps. People find that in different ways. Chemo brain, during and after treatment is awful. I I would swap words. I would not be able to come up with a word or a name. I was talking with my spouse because of the enlarged prostate. Before I knew that I had the prostate cancer, I was having some urgency and frequency issues. And I said to my spouse, gee, you know, I really have to call my gynecologist about my pee problem. And there was just this stare back at me. And I said, and I realized what I had just said. I said, oh, you know what I'm talking about. You know, I meant my urologist. I'd call the dishwasher, the washing machine, and the dryer, the dishwasher, and I just was all sorts of screwed up. It does get better over time, but I'll hold on to chemo brain to lay fault on forgetfulness as long as I can. The tamoxifen there are reports, as I said, of tamoxifen fog, which has similar kinds of impacts. So I'm a little less forgetful. Names seem to be the worst at this point. I could be looking at somebody and know I know their name and then just not be able to retrieve it. Let's see. I've got some notes here. I just want to make sure that I didn't miss anything. Insomnia. As I stated earlier, I slept in 4-hour shifts, like clockwork for some reason. So when it was time to go to bed at night or go to sleep at night, I'd be wide awake because I had napped on and off during the day. The day before my chemo, they put me on a steroid, so I would have to take that steroid that day before. So at least the first and second time that I took it, I was wide awake overnight, all night long, and just couldn't get to sleep. And I still find myself sleeping in, 4 to 5 hour clips, and then getting up and then going back to sleep. I just try to clear my mind as best I can, try to think of other things, listen to relaxing music, sounds of nature. I have a machine that creates nature sounds by my bed, so I use that sometimes to help me relax and helps drift me off to sleep a little bit better. That's it.